everybody. Welcome to the Mental Health Advocacy Network podcast. It is a show for really the awareness of sort of the need for community-based services of mental health in the state of North Dakota. I am your co-host, Patrick Kirby. I'm the founder of Do Good Better and the host of the official Do Good Better podcast. And with me, my co-host, Matthew McCleary. How are you, my friend?
Doing good today. It's great to be here. I am the Deputy Director for Mental Health America of North Dakota, as well as the North Dakota Federation of Families for Children's Mental Health.
You've got a smart human being on the other end of this podcast microphone. I am genuinely a more curious individual, especially while working with organizations across the state about mental health. And I think that's where this podcast is going to originate from. It's a general form of curiosity, having experts that we bring on for explaining things like 1959, state hospital, all the things that we sort of were curious about. We're curious about funding. We're curious about expanding general awareness and advocacy here in the state. And that's kind of what this podcast is going to be all about. Matthew, why don't you give a little background on you and sort of why we've sort of banded together here for this podcast about mental health?
Okay, so I am first and foremost a person that has utilized mental health services through my childhood and adulthood. I was a special education student growing up. I also became a recipient of services through what was then called the Partnerships Program, which was designed to provide what they also call wraparound services for families who have children with mental health disorders. And it was designed to have every provider that provides services, including the schools, come onto the same page and figure out how do we provide services and supports to this family and this child so that they can do well in all things that are important to this young person and their family, which included at the time, school, as well as the strength of the family and our recreational activities that we would have had. So I kind of grew up within this mental health field and became a professional within the field. And we started doing a lot of advocacy for children as well as adults with mental health disorders. And we kind of found ourselves in a unique situation over this last decade where there were a lot of problems that were being exposed in North Dakota's mental health system of care. And so Mental Health America, the Federation of Families, and a lot of other organizations gathered together to create an entity called the Mental Health Advocacy Network. And we did that to try to unite our voices together around one common vision. And we said that we wanted to advocate for a consumer and family-driven mental health system of care that provides an array of services that are timely, responsive, and effective. And so over the years, we have gathered a lot of goodwill within the state of North Dakota legislators and community leaders to say we need to rethink how our mental health system of care has been administered, address the shortcomings that were really becoming apparent, and kind of embrace very happily the idea that the Americans with Disabilities Act and the Supreme Court decision of 1999, the Olmstead versus LC decision, said that people with disabilities have the right to community-based services before they are required to seek institutional care. And so that has been our driving force. And a lot of stuff has been happening, both good as well as some bad. And we decided that we need to be able to educate the populace about the issues that are going on, as well as find another avenue to advance our cause, to have finally a robust community-based services service delivery system for our mental health system.
It's funny that I have no affiliation whatsoever, did not use services, don't use services. However, worked for several organizations that within the DD community that chatted in depth on how to really use mental health services, that inclusive sort of community-based methodology. And then as I got into a sort of a consulting career, worked with a ton of organizations that had that are kind of under the Mental Health Advocacy Network banner. And we found ourselves together sort of in the same space. My general curiosity on why the advocacy is, or how the advocacy could be stronger. What are the things that we can do to sort of push this particular agenda of openness and inclusiveness in this community-based services network? And that's really what the podcast kind of started out as. This is sort of a medium that we think is a wonderful way to communicate. And I think part of this is the excitement that you and I can kind of bring to the particular show by bringing on experts in the field, having conversations a little more in depth than you'll get in a snippet or a social media post or a clip on the news, that we can actually ask some of these more difficult questions and really sort of draw out longer answers, get a historical perspective on why things are happening the way they're happening and how they started and where they're trending. I think that's what really excites me about this series, is that challenge of how do we really address some of these mental health issues across the state of North Dakota. Where did they start? What's a solution? And who's going to be a good advocate? Who's going to be a good promoter? And how do we sort of leverage our network of folks to help explain some of that stuff?
Yeah, absolutely. We are in desperate need of moving beyond the awareness campaigns that have traditionally existed within the mental health sphere. They're very useful. They're great. It's really great to see the NFL taking charge of this issue and putting out these videos a lot, sharing how their athletes have gone through mental health struggles and that it's okay to not be okay. That's wonderful. That is great. That needs to be expanded. But all too often, that kind of turns into the only message that gets out there. And so what ends up happening, unfortunately, is a lot of people, they're aware that they need help or they might need services, but they have no idea where to go. They don't know what they ought to be able to expect. They don't know how to fill out these forms. They don't know about the way that they could perhaps drive the improvement in the service delivery system. So I think what's useful about this podcast idea is that we don't have to shy away from the nerdy, geeky, bureaucratic details. In fact, a lot of those details are probably going to be the thing that matters the most. It's not necessarily good enough to just bring awareness to the idea that mental health and mental illness exists. We need to know how to solve the bureaucratic troubles that we're going through currently, so that people can move on with their lives and improve the situations that they find themselves in.
I find that the stigma of mental health is still around, even though it has been dramatically, I think, reduced. And I really like what you said about that too. The NFL does a great job too, but that comes in little clips. It comes in little bite-sized attention span as gnat little things. And it doesn't dive into somebody who's got super anxiety, who's up at night going like, what the hell am I thinking about that is keeping me up, and why can't I concentrate here, here, and here? And it's almost permission to go seek and find somebody to chat with, even though you don't think you might need it, right? We're self-aware, I think, enough to know that we're probably got an issue. But then what do you do? And how approachable is it? And what I love about you, how much paperwork do you have to fill out, for God's sakes? I mean, that is probably one of the most bureaucratic things ever, is here. If you can fill up enough paperwork, you totally apply for this, this, and this. And I think that's really where we can get into some of the weeds and the nerdy stuff that a lot of folks wouldn't have the attention span for, because you're doing this in like little 30-minute doses rather than 5-hour hearings or 16-hour reads of policy after procedure after policy. And I think that's really the advantage here, is that this makes it approachable, as nerdy as it will be, an approachable an almost curious reason behind some of the regulations, behind some of the rulings, behind some of the history of mental health here in North Dakota.
On top of that, I think a lot of our state agencies are still at that awareness stage.
Mm-hmm.
They're doing a good job of getting out there. Chances are, if you're someone that's my age or younger, you're on YouTube a decent chunk of the time. And if you're located in North Dakota, Google's going to understand that you live here. So there's a decent chance that you're going to be fed ads from the behavioral health division. Mm-hmm. And so that's an important breakthrough in many regards. But I think there is an extent to which they are shy about wanting to get into those details with people. The idea that, it's okay, guys, that you can take 2 minutes and 30 seconds to explain what this thing is and then share it virally. Yeah. People on the internet have been doing those types of clips for many years, but a lot of our government agencies have not caught on to that you can get into those really big discussions and get it down to 2.5-minute clips here or there. If somebody's talking for 45 minutes, you don't have to listen to an entire 45 minutes just to get the really big details that you need within a short period of time.
Yeah, and I think that's the advantage here, that you and I are going to be able to pull some of these clips out and start the discussion that are longer terms. Whether it's taking some of the things that we ask some of our guests and taking a clip of it and then blogging about it, or sort of putting together a little bit of a social media piece to begin that discussion for the longer term advocacy of mental health here. I'm curious to see, because we've got a laundry list of things that we're going to have and talk about over the course of this podcast and guests that we're going to have on. I'm curious to see some of the interesting ones that you're looking forward to talking about or talking with as far as topics go. I've got mine that I'll reserve. But as a resident official who's got the fancier title and really understands sort of the nuances of mental health within North Dakota, what are you looking forward to as far as this podcast goes from a topic standpoint?
What the last legislative session has shown us is that there were, or even the last few legislative sessions, there are a number of changes that are going on within the state, many of which are good, that a lot of people don't know what's going on. And that doesn't necessarily mean that the people that ought to be knowledgeable about the what's going on or even aware of them themselves. Mm-hmm. A lot of the times we're finding out about these changes last minute by word of mouth. And a lot of our service delivery system is not necessarily letting people know about these changes that are going on, or they feel that it's way too much for them to cover at any given point in time. So they don't necessarily throw it all out there. And so there are a lot of issues that we have been looking forward to discussing that get really complicated really quickly. So that includes the discussion of the 1915I state plan amendment for our North Dakota's Medicaid plan. This was one of the crowning achievements within the last couple of legislative sessions, when what we were looking for was a really big bang for buck improvement to the mental health service delivery system. And Mental Health Advocacy Network joined a lot of the calls to say, hey, we need to apply for this. What this will allow you to do is to give services that were either not available before or not available enough to people out there if they have Medicaid. So if they have Medicaid and they meet certain eligibility criteria, can they get a whole lot of community-based services that we had been in desperate need of for over a decade or longer? And those specific details on how each of those things operate very much interest me. What's also of interest to the public is whether or not our state government is designing these types of programs as thoroughly and or as thoughtfully as they could, or if they need to gather information from the public to then go, okay, this isn't working the way that we want it to, so we need to make adjustments here or there. Mm-hmm. And I think some of those conversations about what's going on in the community and whether or not they need to make changes, or as a result of this podcast or other avenues, to be able to influence those decision makers to get them to think, okay, we might need to do something about these shortcomings, and then to kind of give them some ideas about what may or may not be a good idea about how to address those issues. So that's one thing that the entirety of the Mental Health Advocacy Network is really interested in, is making sure that we're not only able to get really substantive information from people that know what's going on, but that we can also maybe influence the dialogue going forward about what we ought to expect as a society that that is supposed to be providing and supporting people with mental illness and their families.
Yeah, I like that a lot. And I think one of the things that I'm really curious about too, and we'll explore this in a couple of different episodes, is the state hospital in general. I don't think a lot of people, even myself included, even working in Jamestown, North Dakota for a number of years, didn't even know that the state hospital was mandated by our Constitution. Fun fact, I don't think anybody knows that. And so really exploring the history of that. Why is that a thing that North Dakota first, started? What was the purpose behind it? And when they built it, what was the purpose of that? Can we talk a little bit about deinstitutionalization? Can we talk a little bit about community-based services when they did? Are we moving back to a sort of an institutionalized sort of thing? What does that look like? What are the signs that we should be watching for as somebody who is, keyed in on a couple of things? They're like, oh, that sounds like a little more institutionalized piece of legislation than we should be maybe accepting. And then really, what does it look like to modernize that state hospital? Is there room for expansion? What does that look like? And I think some of those exploratory questions on this podcast are going to be fascinating as we bring on some guests and even getting your perspective from, your experience within the system itself, working, sort of on this every single day. And I think that's really where this is going to be such an adventure, dude. I'm really excited about this as a podcast, as a tool, as a medium, just to begin that discussion, not only for advocacy, but for really enhancing our community-based service conversation that we have both at the state level, at a local level, and even looking at your own family and saying, hey, what are the services that I should be getting, that I could be getting, and how do we navigate this crazy, lots of words in between it? How do we make that a little bit easier on the ears, on the eyes, and all the senses, trying to navigate this crazy world of mental health?
And I would say that generally speaking, what Mental Health Advocacy Network is looking at is that mental health services should be this vast array of services that exist and are provided to you conveniently depending on your need. And so you're going to have those raising awareness moments that I talked about earlier, those healthy conversations that can start in schools, that can start amongst family members or whatever have you, little pamphlets that people hand out, television ads. And then you can get into what do we do if a child is not doing so well? Are there certain services that can be provided within the school environment? What do those look like? And then on top of that, what if the situation is worsening for a child or an adult? What kind of services do they expect or ought they expect to have in the community? Then you can have discussion about, okay, what happens if we're reaching a crisis moment for an individual? What services ought to be located nearest them? And then we can also look at the state hospital. So the state hospital can be like among the more severe end of that spectrum. So you have to, what Mental Health Advocacy Network wants to do is make sure that the entire thing is healthy. Yep. And so by wanting improvements in one does not necessarily negate improvements in the other, but we want to make sure that we keep our eye on the ball, which is that people with mental health disorders and their families ought to be able to receive the help that they need as closest to their home as possible in the timeliest manner possible. It needs to be convenient and effective for them. It can't be the way that we used to do things where we ship people out into a town far away from them or even out of state because there might not be beds. So Mental Health Advocacy Network is really interested in advocating for the idea that we need as much help as possible all over the state. And it doesn't need to look one way, but it needs to prioritize making sure that people are able to live in their homes, in their community, and thrive as they ought to be able to as American citizens.
And I don't think anybody listening would disagree with that. It's how and what do we need to tweak and what do we need to use currently to make that happen. Well, I am so looking forward to this as a podcast series. Matthew, you were fascinating as always. And I think we're going to have a really good time diving deep into some of these questions, some of these topics, and really looking forward to really sharing our advocacy, conversation with those who are listening, and really excited for what we have in the future. So from all of us here over the Mental Health Advocacy Network podcast, stay tuned, folks. We've got a really amazing series coming up, and really excited about that. So thanks for being on the journey, my friend.
Thank you.